Clinical documentation is a major hassle for physicians. So it's no surprise that one of the first big use cases for generative AI in medicine is listening in on patient visits and automatically generating notes for the EHR. Microsoft's Nuance Healthcare Division recently rolled out Dragon Ambient Experience, or DAX, which combines conversational and ambient AI with ChatGPT. Hi, everyone. I'm David Williams, president of strategy consulting firm Health Business Group and host of the Health Biz Podcast, a weekly show where I interview top healthcare leaders about their lives and careers. My guest today is Diana Nole, Corporate VP of Microsoft Health and Life Sciences and General Manager of the Nuance Healthcare Division. If you like this show, please subscribe and leave a review. Diana, welcome to the Health Biz Podcast.
Hey, it's great to be here.
So want to talk about, obviously, DAX and all the exciting things you're doing now and into the future, but let's wind the clock back and talk a bit about your background, your upbringing. What was your childhood like? Any particular influences that have stuck with you?
Yeah, so I had a wonderful childhood, had a great growing up. I think one of the most impactful things is probably the fact that I am a first generation college family. So it was extremely important to my parents that myself and my three siblings, we all had the option to attend college, and they helped us. They helped us achieve that while also generating what I think are values that have continued to stay with us. And that is really around working hard, doing something that you're passionate about, and really giving back. I would say growing up, one of the things that I clearly loved when I was going to school was math. I really loved solving problems. And so at the time I was going to college, computer science seemed to be a natural selection along with it. I think that whole problem solving passion has stayed with me throughout my career. And then I think another strong influence was certainly my own father's career evolved. He did early days, he ran data centers in the telecommunications industry, certainly an industry that's always been at the forefront of transformation. And he ultimately did that and moved into more general business management as well. So a little bit about my early days.
No, that sounds good. And I think, being interested in problem solving is good. There's a lot of people who are good at taking a problem and complaining about it. If you can actually solve it, that's likely to be a good key to advancement. We were talking before the show about Potsdam, New York, because I have a brother who lives there in SUNY Potsdam, which people know about, but I think you may be my first guest that I've interviewed that went to, not to a SUNY, but went to SUNY Potsdam. What was that like?
So this was really interesting. So I went to high school in Iowa, and I was all set to go to Iowa State. And my father was offered the opportunity to transfer, and he could either transfer to Minnesota or to the eastern part of New York State. And he ended up transferring to the eastern part of New York State. And he and my mom sort of begged me to say, hey, wouldn't you come out here and consider it? The house that they bought, the people that were selling it, their daughter went to SUNY Potsdam, and they indicated that it was a great school for computer science. For me, it was a great college town because it's very close to the Canadian border. It really is the North Country. It is a college town. There is SUNY Potsdam. There's a great engineering school called Clarkson. And once you get there, it's really about going to college. So it was a great environment.
Nice. And University of Rochester later on, was that after you started working, or did you go straight?
Yeah, that was while I was working. So, and I think for me that worked out well because I had been working in various functional roles early in my career. I worked at a large global company, Kodak, and I had the opportunity to work in a variety of functional areas. That was a great thing about it. And then about 10 years in, I decided to go back and get my MBA, which they supported. And one of the wonderful things out of the MBA was I met my husband. Nice. Some schoolmates introduced us. And I think for me, going back to school and getting my MBA, I really understood a lot about technology, but I did not understand anything about financial acumen. I didn't know how to read a P&L. I didn't know all of these business terms. And so if I was in meetings, I really felt a little lost with the terminology that was used to kind of run a business. So it really provided a great complement to, I think, the 10 years of work experience plus my undergraduate degree.
Well, I met my wife in business school too. It was well worth it, just for that. And it's interesting, Rochester, Kodak in those days, Kodak was making so much money. The people who were running Kodak didn't need to know too much about finances either, and it actually come back to hurt them eventually.
It
That's a story
did.
for a different podcast.
There is a lot of learnings there. And so, about 15, 16, 17 years ago, I probably made one of the wisest choices I had made also at the time. And I went to the Kodak Health Group, which ended up being sold. It was a wonderful business, but Kodak was going in a different direction. And I had the opportunity to go through another career learning experience, which is the carve out of an organization, setting up everything you need to run it, and being run by private equity into the company that was called Carestream. And that was my first really entry into healthcare. It was a very clear decision for me that I wanted to get into healthcare. And that was really another pivotal moment in my career in terms of deciding which industry I wanted to be part of.
Great. And then after that, I saw you're at Wolter Kluwer, which is a real interesting business. And of course, they have the real gem of Up to Date, I think, as part of the group that you were running.
That's right. So about 8 years into Carestream, I said, I really would like to do something a little different again, wanting to grow. And I had the opportunity to work for Wolter Kluwer, work for a great leader in Nancy McKinstry. And their division had been going through, again, transformation from being sort of curated content to being much more a software tool set. You mentioned one that's up to date. They have a lot of other iconic brands. These are all usually used either in educational opportunities for clinical people or decision support. So they have, as you mentioned, Up to Date is one of their really premier, almost sort of cult following solutions. And I had the opportunity to run that business, which was really wonderful.
And Wolter Kluwer is another place that doesn't have the most conventional way of doing their strategy and the way that they have their financial measures and things. They're different, I think, from some at least software companies. And I'm wondering if that's in fact the case and how that affected what you did there.
Well, I think at Wolter Kluwer, what we really were focused on at the time that I was there was we had done a lot of acquisitions to sort of transform. And so we were integrating a lot of those, but it really was around how do people actually use, in particular in the healthcare division, how do people use these tools to ultimately change the decisions that they might have made to get better outcomes in terms of, for patient care. And so, the real focus was obviously you need to grow and you need to grow the adoption and you need to grow the usage. So a lot of the metrics were around how many encounters are we impacting, how much usage are we getting, is it really valuable? And that kind of aspect around the ROI of the tool really has to be there.
One of the things that occurred, I think, during the time you were at WK is the real adoption by everybody of electronic medical record and the EMR being really the key element of the workflow, and then needing to make sure the tools, which were previously used maybe more on a standalone basis, really had to integrate, with the workflow. And a lot of tools, I think, got sort of pushed aside because if it wasn't directly in Epic, it didn't really matter. But also, I think Up to Date in particular managed to get integrated in a way that it stayed to be central. And I wonder if that's the case. And we'll talk about how that relates to what you're doing now.
Yeah, well, I think you've hit on one big important thing. Wherever the technology evolves to, all of our customers always say that the technology is great, but it has to work within the workflow that I'm used to. And if you're going to have it sit over here on the side and not be integrated and leverage all of the investment that I have in my electronic health record, it's not going to be as adopted. It's going to be extra clicks, and it's just going to add more administrative burden versus taking administrative burden away. So as we've been thinking about and evolving our solutions, and I think in particular, the way that Microsoft works, that's become even more important. And you mentioned, certainly while I was at Wolter Kluwer, we were working heavily with the electronic health records to make that integration with the tool sets as seamless as possible.
Great. So let's talk about Microsoft / Nuance. I'm interested, how did you get interested in the role? I mean, I can see that your background makes you the perfect person for it. But how did you get interested in that role?
Yeah. So I first knew about Nuance when I was at Carestream because we integrated their solution, their speech solution on the radiology side into our solution that we had, our PAC solution. And it just happened to be that I actually reached out to, at that time, the new CEO, Mark Benjamin, who had come
Right.
on in 2018, to talk to him and come over and see him in the Burlington office and talk to him about some other things more broadly in the industry. And this opportunity happened to be there. But I would say, it was kind of at the right time with me also at Wolter Kluwer. I had been at Wolter Kluwer for 5 years. I've always had a great curiosity about technology, but really for the purpose of generating improvement in the business. And so, early on, I learned that technology can be used or leveraged everywhere, but it has to be in concert with change and change management. And I felt as though what the changes were that Mark was bringing just from a cultural perspective and the direction he was taking the company to really focus on this innovation and where can we go to really solve pain points, that was really attractive to me. So it was both the culture he was driving and the aspects of really trying to be just really forward thinking in terms of technology.
We had done some work with Microsoft back in the day when they were getting into healthcare, and they had purchased a Zixi, I think, at the time, and they're
Mm-hmm.
starting up Health Vault, and they brought Peter Newport back, who'd been running drugstore.com, because they figured he knew as much about healthcare as anybody. And there was, I think, a lot of learning, but also some false starts along the way there. It's been quite a while, and Microsoft has matured a lot overall, but also in healthcare. So I'm curious about how Nuance integration with Microsoft has been working out.
So it wasn't shortly after I started at Nuance that I started in June of 2020, and by April of 2021 we had announced this. There was a previous to the acquisition a good strong partnership, and I think that helps in terms of they knew us, we knew them. But the integration really started with a view into a shared vision. So after we closed last year, the joint teams across the Nuance Health and the broader Microsoft Health and Life Sciences came together to really talk about, this is a large industry. It has very complex challenges. How are we going to use our assets to really solve the most important pain points? And so I think the good thing is we have a very shared belief in, really focusing on outcomes. And that has really driven a very strong integration. I think they're respectful of the fact that we have at Nuance, a trusted brand in healthcare. We're deeply embedded into these clinical workflows with hundreds of clinicians using it, but they also have just absolutely tremendous horizontal technology,
Yeah.
industry leading security compliance. So I think it's a really good horizontal breadth. We certainly have taken advantage of their capabilities as we've been building out, for example, DAX Copilot.
Great. And how do you think about AI here? Is AI is obviously totally central to DAX Copilot and a lot of what you're doing. Was that a lot of the vision between Nuance and Microsoft to begin with? Is that a very central thing, or is that just kind of the flavor of 2023?
I think that AI is apparent through all of it. I think sometimes people feel like AI is sort of at the very front, and that's like, what is it going to do that actually interfaces directly with the end user? But if you look at the way we think about scalability of these solutions, it does include like data and analytics, security and compliance, cloud infrastructure. And so when we think about it, AI ripples through all of those, but it's not just at the forefront of, okay, well, AI can give me data insights. It can give me content creation. It can give me user interactions, but it's building it in a stack such that you can scale it with the capabilities that's also very responsible. Certainly AI has evolved. I mean, it's much different even in the last 12 months of the capabilities than what we probably saw 10 years ago, right? It was very
Right.
simplistic in its sense 10 years ago. Now the things that we're starting to see is much more human-like with very complex, problems.
I think Nuance is particularly, there's a lot of companies that we work with that are saying, okay, AI is coming. Like, what am I supposed to do about it? How does it affect what I'm doing? And if I think about Nuance's business going from the kind of traditional, transcription and then kind of, assisted transcription with some natural language processing to really being much more, much more taking the people out of it and bringing in the automation, probably ready for the next frontier as much as any company, or maybe more than anybody else.
Yeah, we see use cases, by the way. We have been focused heavily on the content creation, the clinical document, as you mentioned at the beginning of our session here. But we also see use cases where, for example, in our radiology solutions, a lot of what the radiologist needs to perform their current report is to get information from the prior reports to inform it. And that ability to easily get out data insights from the prior reports, that data insight piece of AI is also very, very beneficial to the space that we're in.
Yeah, and radiology, of course, is a place where AI has been, probably at the forefront, certainly within medicine, looking at images and being an assistant for the radiologist.
Absolutely. And that's where I think there's been a lot of optimism around it, because in my career, we obviously have had things where it's identified in the report, like what you would call hot spots, but the accuracy wasn't always great. So then people didn't really use it or look at it. And now we're getting much more sophisticated, much more accurate. And I think when people ask what has changed with AI, it's the ability to get more accurate, get the scalability, and really get it into spaces where it's kind of now it's more, okay, I can see how it works, I understand it, and I can see the applicability here.
So DAX Copilot, as I mentioned in the intro, is very exciting, and I think is just a great use case. And I'm wondering if you can just give just an overall explanation of what it is, and then if you wouldn't mind breaking down some of the components of it. So these words are not just thrown out there, I know, for marketing purposes. Conversational, ambient, generative, those are all meaningful here. And I wonder if you could just expand on kind of what DAX Copilot is overall, and then how those different elements play in.
Correct. Yeah. So we did announce the general availability of Dragon Ambient Experience, or DAX Copilot, on September 27th. We have long time focused on the administrative burden of clinical documentation. So this isn't the first solution we've had. We've had Dragon Medical One out for many years. And that was a tool that was used pre-visit with a patient and post-visit to efficiently be sort of a work assistant for the clinician to do their documentation. And that's what we refer to as, kind of the early days of this. When you get into conversational and ambient, that's where you'd say, here I am, I'm a patient with my doctor, and I'm having a conversation, and it's being done sort of in the background, that the technology is capturing that, and it understands that you're the physician and I'm the patient. And it also understands when we're having this conversation, it understands what is applicable to the actual creation of the clinical documentation. So what happens is, you as a patient just sit there, your physician talks to you, looks at you face to face. That's great, because he's not, the person is not looking at a computer. And so you have this dialogue, and within seconds, right after the visit, a draft of that note is ready for the physician to look through and sign off on. That's in a structured format that then is fed into the EHR. And so that's at the simplicity of it. It's automatically creating this clinical document within seconds following this visit. And it's doing this in the usage of conversational ambient. And then where generative AI comes into is really around the accuracy levels. So in the background, the generative AI is really looking at how can we get more and more accurate based on when the physician goes in and potentially corrects something that the note created. That is always fed back in terms of an ongoing loop of creating more and more accuracy, if that's helpful.
Great. So it solves a lot of the problems of a patient encounter, and I think this is both from the patient perspective and from the the physician or whoever is seeing them. Because with electronic medical record, great, now you can read the notes, but it's very much the conversation is driven by, I have got this drop down, I have to put this in, and it's not this conversational style that's going to be effective with the patient. The ambient nature of it is that it's just listening in. We don't have to go and dictate it later what happened. And the generative part's interesting because I saw, and you've got a very good demo video, which shows that output that they get initially and what's in the structured fields, and then how the physician can drag and drop it, add to it. And I guess what you're saying is that that then feeds back. So the next time, or whenever they're in a next conversation with the patient, it's likely to be more accurate because they'll understand how the physician adjusted it based on what the DAX had told it.
That's right. So it's it's what we call supervised learning, because the physician is actually the human in the loop that's continually providing feedback, that's training the models to get better and better.
Can we talk now about the concept of the copilot? So I see this all, that's not unique to DAX copilot, but it's a cool term, but I would love you to explain it a little bit and maybe contrast it to other things like, a medical assistant, medical scribe, or just a peer that's there. And, is it really comparable to the copilot of an airplane, who I'd think about, hey, the copilot can take off too and land, and if I had to step out of the room, it would be okay. I'm just trying to understand like copilot and how literally to take that and what it really means here with AI.
Yeah, I think you are correct. You actually, when you do look up the definition of a co-pilot, it's always referred to as, well, okay, that's the second pilot in an aircraft who actually helps the pilot who is in charge. So here, what we're referring to as the co-pilot is that the physician is the one in charge, but the co-pilot is doing something that to some degree almost does and completes it automatically for the physician, right? It can do that in seconds. It can produce this clinical document. I think what's different here is we're using Copilot also as a technology-driven service, right? It's not a human, because you could have a scribe that in essence is producing the same output, but it's a human in the loop, and that's not easily scalable when you're talking about, a Copilot that needs to, kind of scale in terms of being able to be applicable and out there for all physicians. So in some regards, they're similar in the fact that they are producing something that in the end is very similar, but we're talking about Copilot in this sense that actually can do it in the purpose of technology and sort of at the direction of the physician who is the pilot.
Got it. So in the olden days, just to go back on the aviation side of it, a lot of the airplanes had 3-member crews. You'd have a navigator in addition to the pilot and the co-pilot. And now, you don't have that anymore. It's helped to, the technology's helped to reduce the number of people that are required. Given all of the workforce, strains and shortages, do we foresee that kind of co-pilot approach, or, the next evolution of DAX gets to the point where you can do more with fewer people in the loop?
Yeah, so one of the things that we want to continue to do with sort of our Dragon family and DAX, which kind of are a suite of offerings, is being able to provide things where you can do interfaces with the system to do ordering. It could also potentially check things in the background for more and more accuracy with more embedded natures with the EHR. So we released our initial view of DAX Copilot hanging off of our Dragon Medical One application, but we're also releasing in the next few months a version of that that's embedded first in Epic. And we believe when it's embedded in Epic, then there is more aspects of kind of, where does the note get utilized? How can you actually utilize the note within the HR to check more things for accuracy? And so I do think that the use cases will continue to expand in terms of accuracy, other things that you could do with the system or interface with the system through, speech technology.
Great. So you mentioned before that AI isn't just kind of the front end thing that people see. They're now familiar with ChatGPT and they say, okay, that's AI. There's more to it than that. And then there's other elements too that you talked about as it relates to the synergy between Nuance and Microsoft, and cloud is a big part of that. And I wonder how, central cloud deployment is to DAX. Is it just, hey, cloud is important for Microsoft, let's put it in, or how fundamental is cloud as you think about the DAX deployment?
So cloud is very central to the tool sets that we're talking about now. And for a variety of reasons, we want to have things in the cloud so that as we have new capabilities, it's very easy to get it out to the user. That's one thing, so that you're not constantly worrying about, well, what version am I on? When am I going to shut the system down so I can do an upgrade? It's much easier to deploy new innovative technology through a cloud, as we all know and we've gotten used to. I think where in healthcare there's always been sensitivity is it also has to be very good in terms of security, compliance, and so the aspects of what cloud you select are extremely important. That's why for the Microsoft Cloud for Healthcare, we really are doing that in a scalable, responsible way. And we also believe that there are going to be other integrated AI capabilities in that cloud, such as some of those things that have been recently introduced, like Fabric for healthcare, where once the data is out there and it's in the healthcare cloud environment, actually having the end user be able to do different things that they would like to do with tool sets for around analytics or information, data, insights, extracts. It's all in a way that they can easily do that.
Got it. So I'm very excited about, DAX Copilot. I've been hearing about that also from, colleagues in the industry. I'm wondering what you're seeing in terms of how it's being received initially, by different players, hospitals, users, patients, regulators, anybody else. And you mentioned different use cases. So what do you see as kind of the strongest use cases, the strongest feedback that you're getting?
Well, clearly on the last point that you made, family medicine is probably the specialty, the area that's the most overwhelmed. They have an extremely high volume of patients that they need to see, and those patients that they see can have a very broad element of situations. It's not, it could be from any kind of indication of just hey, you have a cold, to you have something very serious, and trying to get through that. The visit needs to be efficient. So we definitely are receiving very high feedback. We've had much higher adoption during our private preview than we've ever had with any solution that we've gone out with. And we do surveys. Obviously, there's a lot of survey information that comes back that said they would be disappointed if it was taken away. They also agree that it's very easy to use. But we also have had, specific customers on their own that have taken a look at what does that mean specifically and in a quantitative fashion. What does that mean to them? And one of our first systems that has been using it, Atrium Health, they deployed it to their primary care physicians, and it created it, automatically and securely, as we said. And they were indicating that it's saving them up to 40 minutes per day per physician. So you can imagine how impactful that can be, right? They're almost saving an hour a day, 5 hours a week. And they think that that's actually going to be even more as they get more and more used to using it. I think the other thing that even when somebody doesn't completely accept the note, people are feeding back that it's a very good cognitive load burden relief. Like, I can see in the note, even if I decide I want to do the note differently, I see everything that was captured in that conversation, and I didn't have to sit there and write all of it down. So that's just a bit of an interesting use case where some people are using it as a memory jogger in some cases, even if they don't actually use the note that was created.
Yeah, I've been working in healthcare a long time, and sometimes I get a little bit despondent that, yeah, it's been great. There's always plenty of problems to solve, going back to what you were saying, but, there's still going to be, and there's still going to be more and more problems and not that many solutions. I feel like AI may actually be one of the approaches that allows us to actually get beyond that. And I'm really happy that you started off describing family medicine, because I know that's not where the big money is. They're not the big customers. But if you think about what the vision would be about a better healthcare system, it is great if a person could go to a family physician and they've actually got the breadth of coverage of knowledge, because it's so hard for one person to catch up. You can imagine AI is helping with that. And they're getting into the system with somebody that understands them holistically, and then making a kind of appropriate use of a more specialized treatment. I think it's good for the patient. And also there's a lot of physicians that might like to practice that way. And so if you think about the next generation of people coming in, it's not going to be the Marcus Welby, single shingle, hold it up and do whatever you learned in medical school. It really sounds like it has the potential to transform healthcare into kind of vision that we would like. Am I being too crazy with that?
I do not think you're being too crazy. The feedback that we get is this has kind of put the joy back into the medicine, the way the physician has always envisioned their role. They wanted to really be in the room, present, and focusing in on the patient and have the system be able to create things that it needs, find things that it needs, help them with the decision making. And so the system is getting more and more intelligent and offering those capabilities. So I think the administrative burden coming down just makes their life go up. I think on the other side is what I saw too, from the patient's perspective, the patients have a much higher level of satisfaction that they were heard during the visit. They can see words that they used actually in the clinical note. So that builds a higher level of trust. And, while I don't have hard factual data, when you have a higher level of trust between a patient and a physician, there's likelihood that you're going to have more compliance with the treatment. They understand what their role is in their own healthcare, and they're not going to go down the street and get a second opinion if they really feel like everything they needed was accomplished in the room with that physician, which I think ultimately then can lower costs overall and increase quality.
Adding another interesting piece, which is there was this concept of open notes that only started a few years ago and started, I think, at the BI with Tom Delbanco, where the patient would, read the notes and that would be expected. And now, and sometimes I've done that. I read the notes and it's like, that's not quite what that's not quite what was what. It's useful because you can see and you can correct, but it sounds like you're now going to have probably a richer note and also more accurate, and that should lead to better engagement, at least among those that want to engage.
I think so. I think you're pointing to a really pivotal item where we are trying to rebuild trust between the patient and the physician. And, the physician has been overwhelmed. They would like to get back to the joy of what they practice, and the patient wants to be listened to.
Yeah. I've recently seen my father had a hip replacement, and they get things that I can tell are from like a patient engagement vendor. It says automatically sent out emails. And then my mother gets it and she thinks, the doctor said this and that. And I'm like, Mom, they just wrote that script way ahead of time, and they feed it to you day by day. If it's actually tied in to the specific case, specific notes and so on, I could see that being much more powerful and directly connected with what you're doing here with this product.
Yeah.
Great. Well, last question, turning back more to the personal side, is if you've read any good books lately, anything that you would recommend or anything that you would recommend to avoid?
Yeah. So maybe it's a little overdue, but I actually am starting to read Satya Nadella's book, Hit Refresh, and it's interesting to read while I actually am integrating into the company and the culture that he has tried to do. I think another interesting book I've been reading is the autobiography of Reverend Billy Graham called Just As I Am. And it's an interesting read for many reasons, but one that I like is to read about how he viewed his long, 95-year life and the nature of what was going on all around the world as it is viewed through his specific role and the learnings he had throughout it. I think both of these offer the reinforcement that we're all works in progress. We are all, as leaders of various kinds or people in the globe, we're all trying to get better and learn and grow. And that's a wonderful thing. I would probably say, I do have to admit that I do read People to stay up on all of the latest about Taylor Swift and Travis Kelce and stuff. So you can obviously see that I have a variety of things that I read.
No, that sounds good. Well, Diana Nole, Corporate VP of Microsoft Health and Life Sciences and General Manager of the Nuance Healthcare Division, thank you so much for joining me today on the Health Biz Podcast.
Thank you.
You've been listening to the Health Biz Podcast with me, David Williams, President of Health Business Group. I conduct in-depth interviews with leaders in healthcare business and policy. If you like what you hear, go ahead and subscribe on your favorite service. While you're at it, go ahead and subscribe on your second and third favorite services as well. There's more good stuff to come, and you won't want to miss an episode. If your organization is seeking strategy consulting services in healthcare, check out our website, healthbusinessgroup.com.